Hey y'all, this is Dr. Ryan Edwards with Windermere Dental in Cumming, Georgia. Thanks again for coming back to check out our channel where we post dental news and information to help you have a healthier, happier smile. We post a video here every Monday, so make sure to subscribe if you don't want to miss out. And if you like this video, if it's helpful, make sure you give me a thumbs up down below. I would appreciate that. All right, so today we're talking about what makes your teeth sensitive. And to clarify, we're not talking about what things your teeth are most commonly sensitive to, like sweets or cold things or even pressure. We're talking about how they become sensitive to begin with. And again, to clarify, I'm not talking about toothaches or tooth pain. We're talking about that zing you get when you eat some ice cream, or that zing you get when you eat like something sticky like a jelly bean and it gets stuck to your tooth. A lot of people get that, and some people are a lot more sensitive to those types of things than other people. So I'm going to try to give you some tips on how to avoid this and hopefully minimize it going down the road. And definitely, if you know what causes these things, it gives you a better chance of avoiding sensitivity in the future. All right, so why would your teeth become sensitive to begin with? Well, all of your teeth have nerves inside of them. We call that pulp tissue. And if something happens to make that pulp tissue become inflamed, then it's much easier for it to become aggravated. Now, if your sensitivity lingers for only a couple seconds, then that's a sign that your pulp tissue, your nerve tissue, is healthy and just getting irritated. If your sensitivity begins to linger for several minutes on end, that's a bad sign, and that's a topic for another video. But for now, we'll go ahead and stay on this one topic of just low-key sensitivity, right? So what might happen to begin with, you can kind of break up root causes for sensitivity, pun intended. You can break up these root causes into three major categories. And basically you're talking about structural or mechanical problems for one. Second one would be some type of chemical irritation to the tooth. And third big major category would be some type of trauma. Now, in your category of mechanical problems or structural problems, one cause would be a cavity. And that's more kind of biological, but a cavity basically breaks down the integrity of the tooth. So I'm kind of putting it in this category. So a cavity can cause sensitivity. Cavity doesn't always cause sensitivity. Sometimes you can have a cavity and not even know it, and that's often the case. But if it gets big enough and close enough to the nerve, then you can start to have sensitivity. Weirdly enough, not every sensitivity is caused by a cavity. So I've had a lot of patients come in that think they have a cavity because the tooth is sensitive, but that's not always the case. But a cavity is one potential cause. Another potential cause would be if you chip or crack a tooth, and it could be the tooth itself that has chipped or cracked, or a filling you have in the tooth. And again, that's kind of a structural integrity problem. If you open up a gap in the enamel or the structure of the tooth, stuff can get to the nerve, irritate it, and cause that sensitivity. Third major cause of mechanical problems or structural problems would be if you use a really hard toothbrush. I think I talked about this in another video, but these hard and medium grit toothbrushes that you can buy at the store are way too abrasive for human teeth. These are great for using on the tile in your kitchen or for detailing your car. But you shouldn't use a hard or a medium toothbrush on your teeth, because what happens is it's so rough, it actually causes mechanical wearing of the enamel. And if you scrub really hard, it can actually start to scratch the root surface and cause gum recession, which exposes more root. And if you have more root that gets scratched and sensitive, then the whole process continues. And it's actual situation, the surface of the root of your tooth is normally covered by gum tissue, and there's also a thin layer of insulation on the root. But that insulation is very easily scratched, which is what the toothbrush can do. That insulation gets scratched, the root gets scratched, you get your sensitivity. And then again, like I said, gum recession can be a result of using a hard toothbrush. So make sure that you use a soft toothbrush or a very soft one. Another mechanical problem that can contribute to root sensitivity or tooth sensitivity in general is a whitening toothpaste. Now, the ingredients that are responsible for whitening your teeth in the toothpaste, and also tartar control ingredients, are very abrasive. So they can also kind of, even if you're using a soft toothbrush, if you're using a whitening or a tartar control toothpaste and you start to get sensitivity, it's probably the toothpaste. So that's another cause for sensitivity as well. All right, the second major category of things that will cause sensitivity to your teeth would be the root cause. Again, pun intended, sorry, can't resist. The major source of sensitivity in your teeth. The second major category is chemical attack. And usually we're talking about acid attack on your teeth, acid erosion of the enamel on your teeth. And the major sources of acid erosion are right here in front of me: coffee, tea, and soda. I ask people about these things all the time because these are the major contributors to acid erosion of teeth in the American diet. We love this stuff. It's good stuff, right? But it is very acidic. Aside from the sugar in it, everybody knows sugar is bad for you. But aside from that, the acid in these drinks and also in foods like grapes, oranges, strawberries, raspberries, those are healthy fruits to eat, but you shouldn't be snacking on them between meals. Same thing goes for these drinks. You should avoid them in between meals. It's best if you want to have these. I will never win the argument to get folks to stop drinking coffee, tea, or soda. But if you've got to enjoy this stuff, the best time is with a meal, and you want to avoid it between meals. And that will help reduce the amount of acid erosion of your teeth, therefore lowering your risk for developing sensitivity later on in life. Another source of actually acid that can get on your teeth is acid reflux. So if you're suffering from that, I would definitely talk to your doctor and see if it's something that needs to be addressed medically for any reason. Okay, the third major category of things that can be a fundamental cause for sensitivity in your teeth is trauma. Now, fortunately, these types of issues are more short-lived, but can be very upsetting. So trauma would include things like grinding or clenching your teeth, which itself can be chronic, but if you get a mouth guard, that can be really helpful. And so you know, the ones from the store are okay for short-term use, but they're actually a bit too soft for you to use long-term. So if you find relief from using an over-the-counter mouth guard, then you may want to investigate getting a custom one so that you don't develop more problems down the road from using a soft device for too long for a period of time. Other sources of trauma would be recent dental work. Actually, anytime we do work on a tooth, it's a bit traumatic for the tooth. We do normally treat it with some type of desensitizer to help it get over the cause of the trauma. But yeah, anything like recent dental work, a filling or crown, something like that can cause a period of inflammation inside the tooth, which can result in a period of increased sensitivity. That usually goes away after a while. Can be a couple days, but it can also be a couple weeks. So try to be patient with that. And again, you can always call me if you have a problem after any dental work is done. We'll get you through it. Another source of trauma that can cause inflammation and therefore sensitivity in a tooth would be a trauma itself, like a fall and you hit your mouth on the ground, or like a sharp blow if you get popped with a football or a soccer ball, something like that. Again, that usually resolves all by itself within a few days, but don't be surprised if you have some sensitivity for a short period of time after that traumatic event. And another item that falls in this category would be crunching on hard foods. Now, I know a lot of people like to do this, especially people like to crunch on ice cubes or hard candy. And I know some people like to, when they're eating popcorn, they like to crunch on the unpopped kernels. All those things are bad to do, and if you do it enough, you can cause inflammation in the nerve tissue in your tooth, therefore causing sensitivity. So definitely would encourage you not to crunch on that sort of thing. Other foods that would fall in this category would be like candied nuts. And I don't want to mention the brand of the cereal, but you're going to know what I'm talking about. If you hear somebody eating cereal and it sounds like they're eating granite from across the room, that cereal is way too hard for you to be eating with your teeth. There's no way you should be eating that stuff. So try to get out of the habit of that. So good. So those are all the really main causes for sensitivity in your teeth. I'll make a video next week explaining how to address sensitivity once you have encountered it. But try to avoid all of these things as best you can, and that will lower your chances for getting sensitivity later on in life. Hope you liked the video. If you found it helpful, make sure that you hit that like button down below. If you have any other comments or questions, leave that down below too. And if you have ideas for future videos, I'd love to hear about that. Thanks a lot. Everybody be safe and have a great week.